Welcome to Get Moving TV. I'm Dr. Chris Land and I serve as your host. Every Mother's Day, every Father's Day, I think about all the poor wives who are listening to their husbands snoring all night. I have almost a permanent bruise in my rib from my wife's elbow trying to get me to turn over. This has become of interest not just to pulmonologists, but also to ear, nose, and throat physicians, to dentists. We have a recent decision from Medicare that really frees us up, that says, you know what, America is getting bigger, we have more problems with obstructive sleep apnea, and today I have with me Dr. David Satnick, who brought this on as an interest as a dentist. So tell me a little bit about your practice and where it's located and how you got interested in obstructive sleep apnea.
Okay. I practiced dentistry here in Ventura for the last 22 years. That is my passion. I love dentistry. About 5 years ago, I kept getting those rib chops by my wife and for snoring and making these god-awful sounds all of a sudden. About six to 9 months later, I went and had a sleep study. It turns out I had a moderate case of sleep apnea. I did not want to wear a CPAP pressure device, so I searched out a dentist who was working on a device himself, and I prototyped with it, and it worked off the get-go. So I all of a sudden had all this energy and had no idea I was really suffering from such a problem. And I didn't do anything for a couple of years. I just went back and did my dentistry and was just amazed by the result I got from the mouthpiece I was wearing. And then I started researching the effects that sleep apnea and snoring have on people health-wise, and the risks that really are involved affecting if you don't treat it. So I did research, started studying ways that a dentist can help the population, and lo and behold, today I help people in the community have a second opportunity if they have a CPAP and they're uncomfortable wearing it, or they have mild to moderate sleep apnea or just snoring, and they can have a mouthpiece that will help them rid themselves of that problem or severely lower the condition.
You know, more and more when people come visit my house, all of a sudden I've got a vacuum cleaner running in the other room, and it turns out it's their obstructive sleep apnea. And what I know as a pulmonologist is that really 6 out of 10 people give it up pretty quickly.
Right, that's what I've heard too.
It's an expensive piece of machinery, but what's more expensive are the accidents on the highway. We took a look at truck drivers and found, gosh, we've got $1 million settlements just because people are falling asleep at the wheel. So,
absolutely.
Tell me a little bit maybe about some patients that you've helped, because that's really what heartens us as physicians.
I had a patient who was traveling from Ventura to Bakersfield, and he'd be falling asleep. He'd say, I started falling asleep about 11:30 in the morning on that drive. And he had severe sleep apnea and couldn't wear a CPAP because he had nasal issues that he just couldn't do it. And he wasn't treating the nasal problem, so he wanted to know if I'd make him an appliance or a mouthpiece, to which I did, on the promise he would get his nose problem fixed also. And lo and behold, he was basically cured from the sleep apnea with the mouthpiece, and had all this energy all of a sudden and could make the drive and wasn't falling asleep and was just so excited. Those kinds of results are what I'm looking for, which really make me know that I'm doing the right thing and helping people help themselves in their own health.
I think we always know that something that people use works better than something that they don't. I see some devices here. Can you just show me just the basics of it? And
basically, the mouthpiece, this is a piece called Somnomed. It's a very high-tech looking space-age device. What it does is it helps bring the lower jaw forward so that it can't go back. And as the lower jaw comes forward, the tongue comes with it, and that is part of the problem, is the tongue is collapsing back on the fringe, on the walls of the throat, closing off the airway. So all the devices out there will do that, bring the jaw forward. This one I like for some situations.
Does that clamp to the teeth and there's a spring that pulls it forward?
Yes, there's, well actually there's a piece for the lower, and there's a piece that fits on the upper, and then on the side are these little screws that you can advance very slowly the jaw forward until you have rid yourself of snoring and sleep apnea, or it's too far forward and you just can't go any further because it's uncomfortable, then you obviously may not be a candidate for that appliance.
Now, with these kinds of devices, usually the insurance company wants some kind of study beforehand, and
Absolutely.
certainly the sleep centers are $1,800 or $3,000, and with the recent change in Medicare ruling, we'd spoken earlier about
Yes.
a device that you dispense out of your office with a physician's prescription.
Correct.
What's that device like? You don't have to have electrodes all over your head?
No, there's, that device where you go and have a sleep study taken at a center is a wonderful tool. The problem is you have to go there and have a miserable night's sleep, but you get a wealth of knowledge. As a dentist, I can't treat anybody without a sleep study. I can do a take-home sleep study, which have a pulse oximeter, something that just fits on the finger, a little piece that goes around the nose, maybe a piece here that attaches to the throat, and you can measure snoring and heart rate and oxygen levels throughout the night, then return the appliance, the kit back to me. I send it off to a lab that a physician reads the data and gives me an interpretation of just what's going on while they were sleeping, and then I can go ahead and treat the problem. So that's pretty much how that works.
And if someone wanted to come into your office, would the wife call up, or it must feel good not to have your ribs punched all the time?
Yes, yes.
So they would call your office? And
They would call my office. We would do the research for them on their insurance to help them know what their medical insurance coverage is. And then I do a thorough exam, make sure that their teeth are candidates, that their mouth is a candidate to have the appliance. We also do research with them and find out just what appliance may work for them. It's not a one appliance fits everybody, and there's a lot of work that's involved to make this work for each individual person. So it's customized for that individual.
Do you have some of the other appliances here?
Yeah, this is the appliance that I actually wear. It's called the Full Breath Solution Appliance. It's one piece. It fits on the upper teeth. It snaps in. And then the lower jaw, I determine where to position it using another medical appliance called a pharyngometer. And we find out where to put the lower jaw so that you can snap your lower jaw into it, and it holds your jaw forward a little bit. Then, to customize it, there are different pieces that can fit in the back that help restrain the tongue like a catcher's glove. And that's the part that I get to customize. And it's the only appliance on the market that allows the dentist to actually customize it and create the cupping effect so that the tongue cannot fall back and close off on the airway, or fall back on the uvula, that little dangling piece that causes all that snoring sound. So there are, and we do it until we achieve the result. So it's a wonderful device. I love this device.
And I see a gray box there too. Is that the?
Well, that was just mouthpiece to show them on a model.
Well, that sounds exactly like the right thing to do. What other specialty kinds of dental procedures do you do in your office?
Well, I do comprehensive dentistry. I look at people's Bruxism habits, occlusal diseases. In our society, with stress is so high, a lot of problems that exist with people, we used to say, oh, you're brushing too hard. But in actuality, it's an occlusal disease of stress on the teeth, and teeth flex, and little fracturings occur over the years and decades, and certain people develop different changes in their recession and shapes of the gum line. So I like to treat that and help people correct those problems.
I heard some probably dental words. I know doctor words slip out all the time. Occlusal disease and
the bite.
Bruxism. Can you give us some?
Absolutely. Bruxism is when people grind their teeth back and forth, either during the day and especially at night while you're sleeping. Bruxism, or grinding of the teeth, is also something that's part of sleep apnea. It occurs a lot in people who don't breathe for extended periods of time throughout the night. Occlusal disease is a disease where the bruxism, or the grinding or clenching of your teeth, puts so much stress on the teeth that there has to be a give and take, and sometimes teeth start to break down, gums start to